Okay, we'll talk about what's going on with the data. As you can see, active cases in Clay County as of January 3rd, up a bit, 364. We talked about that there would be some lag in the information over the holiday, of course. So we had 325, the number of cases on December 27th, and now we're seeing 364 as of January 3rd. And there is still some lag due to the holidays in the numbers. Active cases in Minnesota, 26,106 on December 27th. Then January 3rd, we see an increase, 33,147. In Cass County, 599 December 27th, and then they are reporting 474. So a bit of a decrease in January. In active cases in North Dakota, 1,858, and now on January 3rd, they're reporting 1,629. So again, maybe a little bit of a lag is what we're seeing in some of the active cases. If you look across the nation, since the number of cases the New Year's weekend, there was an intense rapid spread of the Omicron variant. So they are reporting that there's 3 times as many new cases as in any previous wave of the coronavirus. So a huge number across our nation, and there's been over 1 million reported just on Monday. So we're seeing a real large spread of the Omicron variant. Active cases by age is our next slide, and we're seeing, again, broken down by the age groups, we're seeing the highest in Clay County in the age group of the 25 to 29. Clay County cases per week, and so this is starting August of 21. And you can see the number of cases each week as we went through 2021, and the last number of the 2011 as reported on 2026, although that's, again, preliminary number. That number will catch up, but so we're seeing, you see the highest back in October, and then it kind of fluctuated. We saw another spike in November, but so it's kind of been up and down each week. We're looking at now the Clay County cases per week, and this starts out from March of 2020, so since the beginning. So it shows the waves as we see that have happened throughout this pandemic. We're anticipating of course, an increase in cases. They're anticipating another surge, another wave over the winter months. So as the variant continues to circulate, it's really uncertain how this is going to look. Here's our cumulative cases by age group. And again, highest number cumulatively is the 20 to 24 group, and then the next one is the 30 to 34. So there's the ranges of all the age groups. We're seeing total cases of 13,343 cases cumulatively in Clay County. I know they've been currently reporting there's over 55 million confirmed cases across the U.S., so that's a staggering number, and over 826,000 deaths. So we're really seeing, large numbers now as we're moving forward. And then I'll turn it over to Becky.
Morning. So this is the updated graph from the CDC that shows the level of community transmission throughout the state of Minnesota. So the majority of Minnesota remains at that high level of transmission, including Clay County. There are 2 counties, Norman and Traverse County, that are now at substantial transmission.
Okay. That's your county.
Yes.
That's why
Are you responsible for that?
she's doing a good job.
And then this graph again shows Clay County deaths per week. We have not had any newly reported deaths over the past week, so our total number of deaths stands at 113 for the pandemic. This is hospital admissions of Clay County residents per week. For last week, you can see that we've had 6 admissions reported so far. Again, not a surprise if that number will increase as the data catches up. And then hospital capacity for our local systems in Fargo. So at the time of this report, there were a total of 6 staffed adult ICU beds available in Fargo and 4 pediatric ICU beds available. You'll note that the Fargo VA has not updated their information since December 16th, so that those numbers are dated, and unfortunately, those are the numbers we have access to. Statewide in North Dakota, a total of 16 available ICU beds available for adults, which is down a bit from last week, and then a total of 7 pediatric ICU beds available. And then this is COVID hospitalizations throughout the state of North Dakota. They are up a bit this week compared to last week. So a total of 129 currently hospitalized due to COVID and 19 in the ICU. Pediatric admissions are also up. So there's currently 5 pediatric patients hospitalized due to COVID. And then the graph on the right shows cumulative admissions broken down by age throughout the pandemic. And this is the updated graphic from the Sanford Healthcare System as of December 28th. So we continue to see the same trend week after week. It's largely the unvaccinated that are being hospitalized for COVID. So 43 of the 47 patients currently on ventilators are not vaccinated. This is the vaccine breakthrough report that's put out by the Minnesota Department of Health every week. Again, I included a side-by-side comparison from last week to the most current numbers that we have. So breakthrough cases cumulatively for Minnesota are at 4.261%. Breakthrough hospitalizations are at 0.165%, and breakthrough deaths at 0.032%. So we continue to see very, very strong protection against severe disease and death from COVID with these vaccines, even though we are seeing an increase in infections.
Jamie? Okay, good morning. Looking at the statewide vaccine data, data for December 29th are for those over the age of 5, almost 68% of Minnesota residents aged 5 and over are fully vaccinated. And then over 1.7 million have had their booster dose or their 3rd dose. And then I just took a quick peek at Minnesota data too last night, and 53% of the entire population of Clay County is fully vaccinated, and that includes the population that is not eligible, those under 4 or under 5 as well. And the majority of those, the highest is in that the 65 and over, so 93% of those. So we're continuing to do a good job on the data across Minnesota. Looking at the Clay County data, we're close to what the state ranges are for all of those age groups. So efforts continue. So then if we can go to the next slide. Then looking at the doses administered by Clay County Public Health, we have 18,674 doses that have been administered to date. Last week, just 56 doses. So if we can go to the next slide. The breakdown of the 56 doses that were administered last week, again, that was a short week for us, but we had just first doses 3, continue to have a few, second doses 2, third doses are the boosters, the majority of 30, and then the pediatric doses of the 5 to 11. First dose is 7, and then we're doing our second doses as well, so we've got 14 there. And then we have a clinic, just one clinic this week, but it's split into 2 time frames in the ITV room at the Family Service Center. That clinic is on Thursday. Our first clinic is from 10 to 2 to cover the lunch hour. And then we'll have Moderna available this week, so we can have first, second, or our booster doses for Moderna. And then also Pfizer. So Pfizer for our afternoon clinic is from 3 to 5 as well, and that is for 5 to 11-year-olds. And then also anyone for Pfizer doses can have that. So Pfizer first, second doses for 12 and over, Pfizer boosters 16 and over, Thursday clinic 10 to 2, and then also from 3 to 5. Any questions about that?
Didn't Pfizer just authorize the booster for the 5 to 12 or something like that?
Yes.
Yes, Madam Chair and Commissioner Campbell, the FDA expanded, so that's maybe the new announcement. They expanded the Pfizer booster for the 12 to 15-year-olds
okay.
under emergency use authorization, and then also recommending a wait time from the 6 months to 5 months. However, the CDC has not signed off on that, so it's not available yet. We'll still be, watching for any recommendations from CDC, but that's the recommendation from the FDA.
Thank you.
Thank you. Do you have vault information?
They have not sent out any vault information. I suspect we'll get it late today or tomorrow. So next week we'll have more updated information.
Thank you. Commissioner Kaylee?
Yeah, a couple questions. On the Sanford chart, when they show on ventilators, that is purely people who are on ventilators for COVID infections, correct? Not car accidents or anything else. I did also notice that our pediatric hospitalizations are up a bit. That's a little concerning to me. And what else did I write down? I don't remember what my other question was, sorry.
Oh, Madam.
Oh, sorry, I wrote it down. How smart of me. I wanted to ask Becky, when we talk about the surge that they're seeing in the cities right now, and we look at what's kind of happened over the course of our pandemic, how far behind the cities have we been in some of these case surges?
I think it's varied. So we are anticipating to see a surge. I can't tell you for sure when, but how transmissible this new variant is, I would anticipate over the next couple weeks that we'll start seeing cases rise again.
And then I'm hearing a lot about people doing at-home tests, that they can just buy over the counter. So if somebody tests positive at home and then they quarantine, we don't have that data. If they do go in and seek treatment, like for instance, go to the ER or get an infusion or something, do we then get that data later, or what's happening with that piece of information?
So we would only get that data, if the provider were to test the patient again, and then, any tests that are not reported by a lab to the Minnesota Department of Health, we wouldn't know about.
Commissioner Campbell?
Can I do a follow-up to that question? So, I think there is a lot of self-test kits available now, and there are people using them. And if they do test positive, of course, the message is for them to notify their healthcare provider that they've tested positive, correct?
Correct.
Isn't that the suggested guidance that should be followed there?
Yes.
And then if they do that, and then they follow the quarantine and all the other stuff that goes with it, but if they do notify their healthcare provider that they've tested positive, does that then hit your records?
I don't think it would unless the provider orders the tests.
So, okay, so they don't.
We only get notified.
They don't recognize necessarily the self-test as a positive test.
Correct, the over-the-counter ones. If it's a vault at-home test that someone orders, those are reported to us. Yes, it's the over-the-counter ones that you buy at pharmacies and grocery stores. Those ones are not reported.
So Commissioner Kaylee, do you have a follow-up?
Yep. So then, for those that test positive and then stay home, I'm wondering what the current quarantine procedures would be for household members then, if you are living with somebody with an active COVID case but you haven't tested positive, or perhaps you had COVID, you recovered, but other people in your household are still positive. So if you could just clarify a little bit of that.
Sure. Yeah, the household close contacts is among the most confusing guidance, and we're in a little bit of a limbo period because the CDC has announced their new guidance, but part of that we haven't gotten the details of household contacts on that yet. So prior to last week, the recommendation would be if you are fully vaccinated or if you've recovered from COVID within the past 90 days, you would not be required to quarantine, even if someone in your household has tested positive. That being said, if none of those hold true, you're not vaccinated and you have not recently had COVID in the past 90 days, you would need to quarantine for 14 days after your last contact with the person that's tested positive. So that really can get drug out. If you're not able to isolate from the person, it can be up to 24 days. So
And
we're
that-
waiting to hear if any of that's going to change.
That close contact, we're not talking about like touching necessarily, it's within 6 feet for 15 minutes or longer, is that?
Correct. So we really want people to be in different parts of the house. If they have a basement area that's livable, they have their own bathroom, kitchen area, really limiting contact at all, which is not always feasible.
Any further questions?
I have one more that I want to go back to, and maybe this kind of another backup question to Commissioner Cayley's questions regarding the ICU. We've been getting a lot of information about available ICU units. I'm curious as to how many total ICU beds do we have? And how many of the ICU beds are as a result of COVID? This goes to there's an awful of other reasons why ICU beds are being used in our hospitals over and above COVID. And I just want to make sure that we're not attributing all of our ICU beds to this pandemic issue, because there's still several other reasons for ICU beds. And I guess I don't, we always see how many ICU beds are available, but nowhere do we really see the comparison to the occupied ICU beds. Of the occupied ones, how many of them are pandemic related versus other? I don't know that I've ever seen that information.
And I don't know that we have access to that specific information. So we have, the availability, really, the issue is staffed beds. It's not necessarily how many beds the hospital system has.
Oh, I'm not trying to undermine the importance of the number of available beds. I'm just curious as to, there are other demands on ICU beds over and above COVID. That's what I'm getting at.
Becky, just to follow up on that, are the numbers that available ICU, are those available COVID ICU beds?
Those are in general for anything.
All.
Yes.
Okay.
So that's kind of the distinction between that graphic where we show number of people, the Stanford graphic, those are specific to COVID, but the hospital capacity is for anything.
And Madam Chair and Commissioner Campbell, yeah, we don't, to differentiate the number of beds that are other medical conditions versus COVID, we don't have access to that.
Right.
I can try to reach out and see if there's some information we can get.
I would think, without getting into too much personal information, that there should be some sort of information available on that. I mean, if a person goes in and has a triple bypass, you're going to end up in ICU for a while.
Correct.
A lot of times, any types of surgery you have, you might end up in ICU for a little bit. And I guess there's I'm just curious as to what percentage of ICU is being taken up as a result of the pandemic.
Yeah, I can see what information I
Thank you.
can find.
Any other questions for the team? Not, thank you for your continued work. We appreciate
Thank you.
Thank you.
Thank you.